This good-looking young man, slide up there. Picture was taken in 1972. And the opening of the first group home in Wisconsin. At that time, there were no county human services, no services for people with developmental disabilities, mental health needs, older folks. There were a lot of voluntary programs. There was no COP, there were no community aid. Children went to school if they happened to have autism or cerebral palsy or an intellectual disability. We probably were not going to school because we did not have a law that required local school districts to educate children with disabilities. Wisconsin was one of the first states that created that law. Wisconsin was one of the first states that created community services. This was a young man named Keith coming into the Gloria Group Home in Prairie du Chien, where he shared a home with 7 other children. Over the next 4 years, as Wisconsin developed a law creating services to people with developmental disabilities, mental health needs, substance abuse needs, we developed 248 group homes. I helped do a lot of those. We developed what were then called sheltered workshops, the activity programs. A lot of them stemmed from the work that parents were doing as volunteers. So on the Prairie du Chien, there was a human development center that met in the basement of a church 5 days a week, where the parents got together and took turns as volunteers, providing support to their sons and daughters of all ages. So we've come a bit of a way. And Thomas asked me to come here today, not as someone who works for the state, although in truth and packaging, I'm a consultant these days, and I do consult with the state on self-directed support. But he essentially asked me to come today as an old guy who's been watching this service system for the last 38 or so years now, and kind of like Forrest Gump, has occasionally had my picture taken when something or other is going on. I could have had my picture taken when family care and Iris were being developed. And I want to talk just about family care first, and then a little bit back to Iris. And what I was asked to talk about is why family care and Iris must succeed. We talked a lot about that this morning. So, but I want to spend some time first with you talking about the design features of family care, and a little bit later on about what are some of the things that we need to do to make sure that family care and Iris do work. I have a friend named John Nesta, who is a fellow consultant. He's in Portland, Oregon. John has gotten to know what's going on in Wisconsin over the last couple of years particularly. He works across the United States on systems change around developmental disabilities and mental health systems. John called me last Wednesday night and said, "Hey Dennis, are you sleeping tonight?" I said, "What do you mean, John?" He said, "Well, I've been studying Wisconsin system. Do you know that you guys are on the verge to pull off of creating the very best long-term care system anywhere in the United States?" I said, "John, I actually know that." He said, "Well, that's probably not, I mean, that's enough to make you get excited and not sleep at night. But do you also know that what you're creating could very well fail?" And it could. We're not guaranteed success. We're not guaranteed excellence. But what I'm most excited about is that folks, organizations like IFW are willing to bring people together. Those of you here are willing to come together. We have a department, and I told Susan I was going to say this only because I mean it, that is listening, with the division administrator in long-term care programs, who is also the head of our family care program, and essentially in charge of Iris as well by that position, who is truly reaching out saying, listen, I'm listening, let's talk. And that is going to be one of our pathways through it.